In this channel, on my video on EIS, I stated that there can be two probable outcomes of EIS program. In one, the child has shown the desired result and is now ready to get integrated to an inclusive setup. In another, the child has not been able to show that much of progress and is now ready to be put into individualized one-on-one sessions in which we give them special education, occupational therapy, speech therapy, and any other services if required. Hello, all my lovely viewers. Welcome to my channel, Sutapa's Alpha Kids. And if you're seeing me for the first time, please do subscribe to my channel. Now, the 10 crucial points include number one, direct instruction. Now, never give complex instructions like go and bring that book and also get my glasses. That is not a very good instruction. Give them simple, direct, short instruction like please get my glasses. Next comes task analysis. Now, task analysis is breaking down of tasks. Break your task or concept into as many steps as required depending on the level of functioning of the child. Then comes maintenance. Now, what is maintenance? Maintenance is actually the practice or the drilling. Most part of your session should be maintenance or practice of the earlier learned concept. And it is also not necessary to teach new concepts or new lesson in every session. Give your sessions more time of your session into drilling of the learned concepts. Give them opportunity for enough of practice. Make them generalize the concept also. Then comes use of multisensory techniques. Now these children suffer from a lot of sensory deficits, processing deficits, so all their senses needs to be utilized. And among the multisensory techniques, VAKT is very, very popular and very, very effective. VAKT is actually the acronym. V stands for visual, A for auditory, K for kinesthetic, and T for tactile. Some children learn faster with visual cues. So for them in their classes, keep as many visual supports as possible. Then auditory. Some children might not look at you, might look here and there, but they are listening properly. So for them, auditory inputs should be more. So that makes their learning better. Kinesthetic is also make the child practice. Learning by doing is always better for all kinds of children, we know. And tactile is touching. If you're like teaching nose, the concept of nose, make the child touch your nose, make the child touch his or her own nose, friend's nose. So that in that way we are generalizing the concept, as well as with tactile inputs the child is learning faster and better. Next comes use of manipulatives. Give them concrete materials. If you are teaching Apple, start your session with flashcards. Do whatever processes you do in your classes, but at the end the child must have a real apple in his or her hand. Like for that, the child needs to hold it, smell it, play with it, touch it, feel it, whatever way, and that makes a child complete in his learning of that particular concept. So use of concrete manipulatives, 3D objects are extremely, real objects are extremely important. Next point is like one concept at a time. Never use more than one concept in one class, or in the child might take like 2 3 classes to learn one concept. Never mind. And next comes reinforcers. Again, regarding reinforcer, there are a few confusion going on, like in the minds of professional and the parents also. What kind of reinforcer can we give in the class? How long a reinforcer might continue, or when and how to use the reinforcer is also a little bit confusing. So you have to know your child more to find out the kind of reinforcer you can give, you need to give, and how long the reinforcer needs to be give has also to be decided by the remedial teacher himself or herself. Then comes prompts. Now again you can check my upload on prompting and fading. I have I've shared detailed discussions on prompting and fading. Prompts can be of various types. It can be physical, it can be verbal, it can be gestural, or it can be the child might require a combination of prompts. And regarding both reinforcers and prompts, I keep saying, telling the young professionals that please, when you are introducing a reinforcer or a prompt or both, you must also plan how to fade it out, because otherwise the child gets too much dependent on prompts or various kinds of reinforcers. Like reinforcers, edible reinforcers are very difficult to fade out, so you need to pair it up with a social reinforcer also. So all these details I will tell you in my another video. And last but not the least, always be patient. That is also another crucial point. Every child has his or her own strength and deficits, and his or her own learning pattern, own learning time. So give enough time and be patient with the progress. And yeah, with that I come to the end of this video, and thank you for watching. See you in my next video.